Opening an addiction treatment center in Texas has one trap: miss the 6-month application window, and the state discards your file and keeps every fee you paid. Texas will not let you linger in the application phase. Run past 6 months, and your whole submission is thrown out. Here is the step-by-step guide to licensing an addiction treatment center in Texas, built for owners and operators. We cover whether you need a license, the Form 3207 application, the strict timeline, and the requirements that are not on the application. Texas is one of the most business-friendly states in the Union, with the 9th largest economy in the world, and a reputation for going easy on regulations. There is no corporate income tax and no personal income tax in Texas, and the warm, dry weather draws prospective patients from out of state. About 7.32% of Texas residents used illicit drugs in the last month, according to one study, pointing to steady local demand. Texas has a relatively exhaustive application process, and the requirements stretch well beyond the form itself. Walk in unprepared and the clock runs out. If you cannot meet every requirement within 6 months of submitting, Texas discards the application and keeps all of the fees you paid. Many requirements live outside Form 3207, under the General Environment tab, so operators who only prep the form get blindsided. Behave Health is a cloud-based, all-in-one platform built for the addiction treatment community, designed to get a new center operational from day one. It brings EHR, billing, CRM, and property management together in one app, so a new Texas center is ready to provide care without stitching tools together. The platform is designed to be used from your phone, anywhere, which matters while you are still standing up the facility. 4 things decide whether your Texas license application clears and whether you keep your fees. Let us walk through all 4. Confirm you need a license. Complete Form 3207. Beat the timeline. And clear the general environment requirements. First, confirm whether you need a license at all. Texas requires all addiction treatment centers, which it calls chemical dependency treatment facilities, to apply for a license to operate in the state. Faith-based organizations are exempt, but exempt facilities may only offer non-medical methods like prayer and scriptural study, with no MAT, DBT, or evidence-based treatment. Second, gather your Form 3207 documents before you start. Visit the Texas Health and Human Services site for chemical dependency treatment facilities. Open new or initial applications, and complete Form 3207. Form 3207 asks for your federal tax ID, IRS EIN letter, certificate of filing, certificate of assumed name, physical address, type of treatment, and bed count. Third, move fast enough to beat the 6-month clock. You must meet every requirement within 6 months of submitting, or Texas discards the application and keeps your fees. The fix is to fully prepare every material before you begin, so the clock never works against you. Fourth, clear the requirements that are not on the form. Both residential and outpatient facilities need a completed ADA checklist and a certificate of occupancy, plus co-location details if you share a site. Inspections must be passed and free of outstanding corrective actions when they are submitted to the state. Residential facilities carry extra requirements on top of everything else. Budget time for each inspection and document. Residential needs a fire department inspection, an alarm system inspection, and a kitchen health inspection. You also need a gas pipe pressure test by a gas company or licensed plumber, plus inspection and maintenance of fire extinguishers and a fire alarm certificate. Finally, a floor plan showing square footage and beds per room, and the name and license number of your medical director. Once you are licensed, Behave Health is designed to run the day-to-day of a new Texas center on one cloud-based platform. The EHR is made specifically for the addiction treatment community, so documentation fits how a new program actually works. Billing and CRM live in the same app, which is designed to reduce the tool stitching that slows down a brand new center. Property management is built in too, which matters for residential operators managing beds across a facility. Stop risking your fees on a missed Texas deadline. Book a 20-minute demo of the all-in-one platform at behavehealth.com. See the EHR, billing, CRM, and property management built for new addiction treatment centers at behavehealth.com.